Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline 3 is where we like to focus on ways to help you live a healthier, happier, and pain-free life. We'll actually be taking any calls and answering any questions that you have live in the studio today. Those phone lines aren't yet open. They will be in just a couple of minutes. That number is 318-219-4569. When you do call, if you're tuning in on your TV, make sure you're in a quiet room so that we can hear your question. Today's topic is cardiac rehab and tobacco treatment services. Joining us today to talk about this are Dr. Robert Martin, cardiologist with Willis-Knighton Health Outpatient Cardiology or Cardiac Rehab. And then we've also got Jarrod Mitchell here with us, who is the coordinator of the cardiac rehab for Willis-Knighton. Thanks, guys, both for being here.
Yeah, thank you.
Absolutely. So cardiac rehab, we talked a little bit on our midday newscast. It's something that's really important, and typically, of course, rehab, you think rehabilitation, something maybe after an event, right? Is that something that you recommend, Dr. Martin, to your patients to participate in?
Exactly. That's right. And that's one of the key times to get patients enrolled in cardiac rehab is after an event. And that could be any number of things, you know, some type of heart attack, a STEMI, a heart attack, or a stress-induced heart attack, or someone who's had open heart surgery, coronary artery bypass surgery, or somebody who's recently had a stent procedure, a percutaneous intervention, opening up a blood vessel through the leg with a stent, or if somebody's been admitted for heart failure. All those are good times to get people enrolled in cardiac rehab.
Right. Okay. And real quick too, let's talk a little bit about what you guys do at Willis-Knighton. Obviously, you're a cardiologist, Dr. Martin. Can you tell us why a patient would come to see you?
So any number of reasons. Some people present emergently to the ER, to the emergency room with chest discomfort, and they're having some coronary event. Some people present with shortness of breath, and that could be heart failure, present with lower extremity swelling. They could present with palpitations or passing out, some arrhythmia or something like that. And so those would all be reasons that patients might present to the emergency room if they're unstable with those symptoms, or to my office in a consult type fashion if they're stable but experiencing those symptoms.
Nice. Okay. And Jarrod, your role at Willis-Knighton is you're the coordinator. So tell us a little bit about, behind the scenes look of what you do.
Yeah, I kind of help supervise our 3 different cardiac rehab programs. We have one at our Piermont location, one on Greenwood Road at our North location, and one at Bossier. And it's a pleasure to be part of the program, to just help see the difference it makes in patients' lives. And they come to us after a heart issue, and what we do is kind of supervise. It's a supervised exercise program, to where we monitor their heart rate and rhythms, as well as blood pressure and oxygen, just because sometimes they're a little uncertain on how they should progress after a heart event. And this helps them, give them that peace of mind. Helps restore maybe a little bit of confidence for them, to help them get back to doing the things they enjoy doing, what they like doing. And it's just neat to see some of their progression from when they start the program to the end, help them reach their goals.
That's great. Yes. And we talked about this on the midday newscast, but this is a choice that patients get to choose to participate in with the cardiac rehab program. And of course, it's something that is encouraged, right? But tell us that statistic that you mentioned. If you have a cardiac event, you mentioned that statistic. Remind me of what that was.
So following a cardiac event, a patient that elects to go through the cardiac rehab program, we see about a 40% reduction in future events. And so that's why we're active referrers to the cardiac rehab program, because we want what's best for our patients. And they do a great job at Willis-Knighton. They've got a comprehensive approach to things. And as Jarrod mentioned, there's some uncertainty after an event. And so getting into a facility where you can initiate an exercise program under the safe and watchful eye of experts, and you're right there attached to a facility should there be any problems, and and then to realize that you're not going it alone. There's a community out there of people who also have maybe on the same path as you, but they're a little further down the road and they've fought through a cardiac procedure or bypass surgery or something like that. And so there's a psychosocial aspect to that as well as the exercise component that he had mentioned.
Right, yeah. And you mentioned you refer out to the program. So what's kind of the relationship between the cardiologist and the cardiac rehab program and the people that staff that?
Well, we kind of help serve the same patients. I sometimes kind of view us as a little extension of their services. They do the great job of just wonderfully helping them get to that point to stabilize the situation. A lot of time they're having a heart attack or major chest pain, and the doctors do a great job of opening that blood flow and helping them out so much. And then we're there for them for that after part to kind of answer questions along the way. A lot of times they're going to have questions on, can I do this yet? Can I do that yet? And we help out on that so much because patients are going to have that, and so we're thankful for them referring patients to us, and I think the patients are grateful for that service as well. Our leadership one time at Willis Knight did kind of they wanted to look at outcomes on bypass surgery, and they looked at 2 patients, and one was great outcomes and one not so much great outcomes. And then they came to us. They were like, "Hey, we talked to these patients, and one major difference was one did cardiac rehab and one didn't." And it was no fault to this other person. They really lived about 2 hours away. They just couldn't do it. But it just shows that being around some other patients, similar circumstances, and a structured program can really get people on the right footing.
Absolutely, yes, and like you said, they have better outcomes usually, and can decrease their chance of having a cardiac event, another one, because that's also a reality that some people that have these blockages that then have a bypass or a heart attack, there might be other blockages that cardiologists like you, Dr. Martin, are watching for, right, that could potentially be an issue later.
You're exactly right, and that's what I tell my patients is, heart disease never takes a day off. I mean, there's different treatments, there's medicines, and some people respond well to medications alone. There's balloons and stents, and with all the advances in technology, we're able to treat a lot of people with balloons and stents. And there's bypass surgery, which is another treatment for coronary disease. But all of those are just treatments. They're not cures for coronary artery disease. And so heart disease is working against you every day, and that's why it's important to have a goal, a plan, and a seamless program to help people reach our desired objectives.
Right, yes, and we do have our first caller. Remind me the name. Vincent. Vincent, thanks for joining us. And what is your question for our cardiologist and our coordinator for the cardiac rehab today?
I'd like to ask a question about how do we get set up with a primary care physician to get in line to your program at Piermont Willis Knighton?
Getting set up with a primary care physician to, I guess, get set up with cardiac rehab? I'm not sure what the correct process is.
Do they already have a primary care physician?
Do you guys have a primary
We
care?
do not. We do not. We just moved to the area, and we've been having a very difficult time getting established with a primary care, but I'm listening to what you do. We could possibly be candidates for your program at some point, but we can't get set up because we're on Medicare.
Okay.
Would the best thing be to call Willis Knighton to get set up with a primary care? I'm not sure if you guys have any insight to that.
I think the website is very patient friendly, and there's an area on there where you can click and search for primary care physicians, and then so you could just access the website for primary care physicians and then ask which ones of those take your specific insurance needs, right. and that should give her a path to finding someone to be that primary care.
Right.
What is the website?
It's wkhs.com. and that's our general website. Another kind of word or phrase to kind of look for would maybe be our physician network. That could be another thing to kind of look at, that they can kind of help out, line you up with an appropriate physician.
Yeah, so WKH.
Thank you very much.
And that stands for Willis-Knighton Health System. So you can also Google Willis-Knighton Health System. That probably would come up as well. But yeah, and also looking at location. So, you know, if you're in Bossier, it may not be advantageous to go to Willis-Knighton North, or, you know, Piermont. It might be closer to go to Bossier, you know, also the location as well. So, so tell us a little bit about how someone can get established in your program. Do you have to be set up with a cardiologist to have that referral to be in the cardiac rehab?
Most of our patients do referred from cardiologists, but any physician can kind of do that as long as patients have an appropriate heart diagnosis. But yeah, our program does need a physician referral to get involved, but it can be any physician.
Okay, yeah, good to know. And that's something that maybe they could talk with their specific doctor about if they're interested in getting that referral, or, you know, if it's the physician's, you know, idea or guidance to be referred to that as well. That could also come up in that conversation too. So, so let's talk about some of those common risk factors for heart disease, and then we can get into a little bit more about what the rehab offers specifically. But tell us a little bit about those risk factors.
Yes, ma'am. So I usually tell our patients there's about 9 risk factors for heart disease. Being a man or a postmenopausal female, roughly over the age of 50, high blood pressure, sugar diabetes, elevated cholesterol, smoking history, family history, being past your ideal body weight, or not exercising 60 minutes 5 days a week or 300 minutes a week, sedentary lifestyle. So those are the main ones.
Yes, and it seems like it's always the things that we hear time and time again for other chronic conditions. And you mentioned sugar diabetes. Are you talking mostly about type 2 diabetes?
Right.
Yeah.
Either type 1 or type 2 diabetes.
Okay.
Yeah.
So type 1 can also increase your risk as well?
Yes, ma'am.
I guess too, if it's uncontrolled too, because, and one thing that maybe a lot of people don't realize is that the reason for that being is diabetes, if it's uncontrolled, it increases inflammation, right? And that can decrease the integrity of your blood vessels, and that could cause issues.
That's right.
Is that right?
Exactly right. Atherosclerosis starts with inflammation in the blood vessel lining, the endothelium, and attracts cells, and cholesterol deposition begins, and that plaque builds up, and that's what triggers heart attacks. And so, yeah, it's all linked back to inflammation.
Okay, and you mentioned 9 risk factors. Do you typically see, how many of those risk factors could you guess that you see on any given patient? It's probably not just one, right? It's maybe several.
Right. It's usually multiple, and there's ways to look at a person's age and their their cholesterol levels and whatever other risk factors they have, and kind of predict their risk for a cardiac event in the next 10 years and their risk for a cardiac event in their lifetime. And that's one of the things that we use when we're evaluating patients in the office to decide what's the next diagnostic test to do to get to the root of their problem.
Okay, all right. And so let's talk a little bit about what the cardiac rehab offers as far as addressing some of those risk factors, and also helping someone get back to their healthiest version of themselves. And this is probably a rigorous program for people that have never changed their lifestyle, right?
Yes,
I mean, it's a change. It's a change, but it's something that we kind of ease patients into. Okay. It's an individualized thing where a patient has never exercised before. We're not going to just max them out or anything. Right. We're going to ease them into it, make it to where, hey, they can get to that next step and start getting to a more elevated exercise routine. Mm-hmm. But yeah, it's exercise, but yeah, so much more. Because those risk factors are what we're going to hone in on. And so we help them, we maybe see some deficiencies, and if that's part of their goals and they want to help in certain areas, we're going to help them. We kind of have like a little addition to the exercise. We kind of just started this up as called lifestyle medicine sessions. Most of them centered around nutrition. They always have a lot of questions about nutrition. And we also have some stress management focus. as well as help them out on the tobacco as well if that's needed. So we have these sessions in addition to the exercise that helps reduce those risk factors and therefore ultimately reducing the chance of further heart issues. So to sum up, cardiac rehabilitation, yeah, part of the recovery, but we're also helping them aim for prevention as well.
Right, right, and like you said, the lifestyle change, and you start where, or you help them where they're at versus, you know, like you said, they're not going to go in and do CrossFit if they're mostly sedentary, right?
Right, some gentle nudging on some of those lifestyle changes. We're not going to come down on them and say, you should do this, you should do that, but we're going to guide them on certain ways. Same thing on exercise. Some people can't walk on the treadmill. They can't do those things, and so we tailor it to them where do some lower impact exercises that's doable, and then they feel better, regain more confidence.
Right. Yes, and confidence is a huge part of it too. Because if you feel like you can do it, then you want to continue doing it. And so, tell us a little bit about the care team that you have in the rehab program. Like, what type of personnel that will these patients be working with?
Yeah. So we generally have a mixture of nurses and exercise specialists that work with patients, and usually the exercise specialists are usually on the floor working with them on their exercise. Nurses are usually monitoring their EKG, and then we have a dietitian involved greatly that helps them out on the nutrition aspects. And then we also have doctors in the mix, and they're in the room, and just in case they have any questions or anything comes up, doctors are in there. So it's definitely a multi-team approach.
Yes, and you kind of need that, especially for patients recovering and getting different perspectives to help them along the way. So when they're referred to this program, the rehab program, what does the typical recovery look like? I'm sure it varies from person to person depending on the severity of their condition. But what is, in your experience, Dr. Martin, does that recovery period look like?
Well, when we refer somebody before they go, and like I said, we usually initiate it while they're in the hospital with a cardiac event, they need to be on the appropriate medicines and be stable. And so usually it's a week or two after their hospital stay that they will then interact with the cardiac rehab team as an outpatient.
Okay.
And they take it from there, and like I said, they've got a very diverse group, and they cover a lot of bases from encouraging patients to be adherent to their medicines, and then the nutritional counseling, and I mentioned psychosocial support, and cigarettes are still a bad actor. I tell our patients they're the king. They beat everything we do. They beat balloons, stents, bypass. They beat everything, and as long as cigarettes are in the mix, the patients aren't going to do as well. And so that's an area that Willis-Knighton's really good at, smoking cessation, and then just the added benefits and recovery from the exercise programs that they have are all beneficial, and like I said, they contribute to that 40% reduction in future events.
Gotcha. And Jarrod, with the cardiac rehab program, when they're referred, what does that typical time frame look like? Do they have like a graduation day that they're looking forward to, that they're finished with the program? What does that typically look like?
Yes, insurance usually covers, it varies at times, but on most cases it covers 36 sessions.
Okay.
And for patients that mostly last around 10 to 12 weeks. So they're in there a good duration, and I think that's very important. It does take some time to develop routines and patterns,
right,
and for help out on recovery as well. But I think if they can establish an exercise routine over a 10 to 12 week period, our ultimate goal is for them to keep that momentum going, and for them to exercise after they get done with us. Whether that's at home or in our great fitness centers that are there, and we kind of want them in our fitness centers. We get attached to them a little bit in the program, and that way we can still see them some. But yeah, you're looking at around a 10 or 12 week program after they get started.
Okay, and like you said, it kind of varies depending on insurance and all that stuff.
Yes,
So,
yeah.
so that would be something that you would probably have a conversation with them at the beginning. Now, if someone wants to, maybe they had this great support system that they've established with the cardiac rehab program, and they don't necessarily want to leave that. Would you say the next best thing would be to connect with the fitness centers at Willis-Knighton?
Yes, we do also have a little maintenance phase if they're just not quite ready to go in the fitness center. That they're not EKG monitored. We still monitor their blood pressure if needed. But yeah, ultimately, very soon thereafter, fitness center will be a great place to be. Great facilities, spacious, and then we're always there if something comes up.
Yeah, that's nice. And it's not the same exact room as the cardiac rehab, right? It's just a different entity.
Correct. Cardiac rehab has its own area inside the fitness center.
Okay.
And so yeah, it's all in the same building, but yeah, separate.
Yeah, but you still have that support and where you can at least see them, because I think that goes a long way. After you suffer from like an event like a heart attack, you want to feel supported, and if you don't have that support system at home, then the rehab program may feel like that only support that you do have, or the friends that you make in that program. So what realistically would someone likely, be, was that covered by insurance, the Willis-Knighton Fitness Centers, or is that something that they would pay out of pocket?
Yeah, that's something like a monthly membership that they would pay, yeah. So that the cardiac rehab is covered by insurance, but yeah, the fitness center would be something that they pay. But again, well worth it, and well worth it for their health. And I just think it's for anyone to kind of be involved in some type of exercise program.
Absolutely, and when you invest monetarily, I feel like you're more likely to continue that physical investment, when you've got that monetary investment in that as well, too.
I came across one thing where they said for every minute you invest in exercise, that adds 5 minutes to your life.
Oh.
Yeah, that's a pretty good investment.
Yeah, I like that. Yeah, and so, what about, like, we were talking about those risk factors for heart disease, and we keep talking about exercise. So you mentioned 300 minutes of exercise, and if someone is currently at 0, what are some of those? As far as prevention, someone maybe doesn't have heart disease yet, but they want to prevent it. What would you suggest that they could start with? A realistic starting point.
It's a great question, and just get moving is the concept they need to embrace. We're too much of a sedentary society, and so we just need to get up and get moving. Too many of us are sitting at a desk or working on a screen or something, and we're not moving around enough. And so wearables are very prevalent, and so you can have a watch or I'm blanking on the little
like the Fitbit
or
Apple Watches.
Apple Watch, and they can quantitate your steps in a day. And so our goal is 7,000 steps a day, and so you just start chipping away at it. Set a personal goal. Maybe your day maybe yours is 500 steps to start with, and then. And after a week or so of achieving that, it's 1,000, and then it's 1,500 or 2,000. Just incremental adjustments to that, with your goal being 7,000 steps a day.
Yeah.
And that's the equivalent of 300, 300 minutes of aerobic activity. And that doesn't mean, that doesn't mean CrossFit. That doesn't mean going all out on the treadmill. That's just walking or exercising at a rate where you can still talk in full sentences.
Okay, yeah. It's funny. Sometimes I wish I could. Walking pads are a big thing nowadays. If y'all have seen those, or it's like a small treadmill. Sometimes that would be cool if we could just have it on the set and we could like walk and talk. That would be, because sometimes we're with work, especially. We're sitting so much, and sometimes it's hard to step away from the desk, but like you said, it doesn't have to be a big effort, maybe just 10 minutes a day, then increasing that to, maybe another 10 minutes later in the day.
That's right.
Correct. Yeah, one quote when you talk about that kind of remind me, it says, you don't have to be great to start, but you do have to start to be great. So just wherever you're at, just kind of start and then you can work your way up and everything.
Yeah. You don't have to be perfect at first. It's just consistent, you know.
Yeah.
And
we have to kind of be creative because we've kind of programmed movement out of our lives. Used to we'd have to get up and go change a channel on the TV or go into the gas station and pay, but now we lose some of those calorie burnings on different convenience things, which are good, which are great. But yeah, we need to make sure we get as much activity as we can right now.
That's right.
That's right. Yes. Okay. And so you mentioned smoking cessation as a big one, and you guys have a smoking cessation program, right, at Willis Knighton. Is that a part of the cardiac rehab or separate?
It can be because we're going to help out cardiac rehab patients in the cardiac rehab program with help in that area, but we also have patients who don't have heart issues or just want help in that area. And so we help them out as well. And so it can be involved in cardiac rehab or it can be totally separate.
Right.
But we have that program, and I tell you what, I think we started it, just really established a good structured program about 10 years ago. And I just knew, I was like, all right, when we start that, I'm going to go talk to patients or they're going to get referred and they're not going to want to stop smoking. But I tell you what, almost 8 out of 10 patients that I see in the hospital, they're like, yes, I want to stop smoking. I want help.
That's
and
awesome.
That was astonishing to me. And so we're glad to help them. It's just they struggle with a way to get there, and we're glad to help them out on that.
Yeah, and having that support for sure. Well, it's funny, I'll share a story. My father-in-law, I don't think he'll mind that I share this, but he had a heart attack before I was in the family. And he, for years smoked. And the reason why he stopped was because the day before he had his heart attack, he asked God, he said, help me take away this desire to smoke.
Oh, wow.
The next day he had a heart attack and he hasn't smoked since then. So sometimes, a crazy event like that can really give you a wake-up call. Unfortunately, in some cases, but yeah, it's not always maybe that easy to stop cold turkey, and having that support is really necessary in some cases. So
yeah, definitely. So sometimes those type of events are motivating for us, and then one of the main things that we try to do when we're talking to patients in tobacco treatment is get them to that point and keep on phrasing things in the way is, hey, how is smoking interfering with things that you value the most, the things that are so important in your life? And we try to help frame that, hey, smoking's conflicting with those things that you really enjoy and that mean a lot to you. And once they get to that point where, hey, this smoking is getting in the way of certain things that I like, then we create that wedge that we can kind of work with and get them on that right direction. Nicotine replacement aids, or medications for helping out, just help ease things and help them be able to get to the point where they can start working on some of those habits and routines that they can bring them success.
Right. Okay. Well, we only have a couple minutes left, but if somebody is interested in being seen, or maybe they have, these risk factors associated with heart disease, or maybe they've had a heart event, but they don't have established cardiologist, do they need a referral from a primary care, or can they call you directly?
Either way, so they can, as we mentioned, the Willis Knighton website, wkhs.com, and they can find a physician in there. But yes, some of our cardiologists in the system take direct referrals, self-referrals, and then referrals from other physicians. So either of those. Okay.
Yes, and y'all have many cardiologists as well. And then from there, if something happen, if a heart event happens, or do you have to have had that recently in order to have been referred to cardiac rehab?
Most patients in our program are recent heart patients, but yeah, in some cases, if you haven't done cardiac rehab in the past and you had a heart condition a couple years back, that can be used for cardiac rehab enrollment.
Okay, yeah, so again, individualized, maybe check with somebody like you, Jarrod, or with their cardiologist to see if their insurance would cover that.
Correct.
So, okay, WKHS.com. You can find more information about the rehab program or about getting established with a cardiologist like Dr. Martin. Thanks for joining us for this Healthline. This will be on our website, ktbs.com/podcast, or also on Spotify.